Welcome to our monthly support group. Thank you everyone for joining us. We're so happy to have you. I want to go ahead and introduce myself just in case you haven't met me or haven't put a face to my name. So my name is Jeanette Rodriguez and I'm the program coordinator for the Riverside Medical Clinic Charitable Foundation. I want to start off by thanking our sponsors, the Riverside Medical Clinic. Thank you for all the support. Today we have a special guest, Meredith, and she is a policy director at Defeat Malnutrition Today. So I'm going to go ahead and give her the floor.
Great, thank you so much. So I'm really excited to be with everybody, and I'm on the East Coast, so that's part of why it's so dark in here. But I am just thrilled to spend some time with everybody, and thank you for having me. I am going to be talking about nutrition and caregiving and why nutrition is important personally, but also why nutrition is a public health issue, and especially right now. Nutrition has never been more important. So getting started, I'm going to talk about what Defeat Malnutrition Today is, because you're probably sitting there wondering, well, why is she here? What kind of, organization is she from? I'm going to talk about the importance of nutrition for caregivers, malnutrition in older adults in particular, but I think that the older adult malnutrition issues are applicable to folks with chronic conditions who might be younger as well. They're also quite at risk for malnutrition. Talk about some resources, nutrition education, so what, why is all this important, and how you can help in both a personal and in a public health capacity. So as I said, I am from Defeat Malnutrition Today. I'm the policy director. And Defeat Malnutrition Today is an organization of we're a coalition of about 100 organizations at this point, and several hundred interested individuals as well. So folks who are it ranges from people who are dietitians to people who are just interested in older adult malnutrition. The organizations range from just regular community groups, healthy aging groups. So, for example, we have organizations like Meals on Wheels America, or the Academy of Nutrition and Dietetics. So some of the nutrition groups you would expect, but we also have folks like the National Recreation and Parks Association. They are very interested in nutrition programs and healthy living. And we also have the YMCA, and we have some faith-based groups, private sector foundations. So it's a lot of stakeholders and organizations that are very interested in recognizing malnutrition as a key indicator and vital sign of older adult health risk. So basically, we're trying to raise public awareness and create policy change toward a greater emphasis on things like screening, detecting, treating, and preventing malnutrition in the first place in older adults. So we are almost 5 years old. We were founded around, actually a few years ago, around Malnutrition Awareness Week, which is a thing. There is an entire week devoted to being aware about malnutrition. And there has been a lot of interest from the community in this. We were kind of surprised. So I started this coalition along with our national coordinator, Bob Blancato, because we also are involved with other nutrition work in the older adult space. And we had started to hear from members of other organizations and from leaders of other organizations that malnutrition is a serious problem in the older adult population. So we were very interested in creating this coalition, and it turns out a lot of other people were interested as well. So we also, we participate in groups like this, national, state, and local conferences. We've been working on malnutrition issues at the federal level. So we do some advocacy before Congress, and we also work with some of the state legislatures. And we released the National Blueprint, Achieving Quality Malnutrition Care for Older Adults, 3 years ago. And excitingly, we have an update coming Monday. We've been working for months now on a 2020 update, and you can visit our website, defeatmalnutrition.today, and the Blueprint tab. You can see the current one, and the new one, as I said, will be coming Monday. So I'm really excited about that. So why, okay, malnutrition, but why am I here? And, you know, first of all, we wanted to start by saying that, proper nutrition starts with caregivers themselves. It's not just about folks with chronic conditions. It's not just about older adults. It's also about the people who are caring for those folks. And caregivers need to take time and to take care of themselves before they can take care of others. It's like the oxygen mask thing. You have to put on your own mask before you help, the person sitting next to you, you help your child, whatever. So as a family caregiver, someone might be overwhelmed and not feel like you can eat a healthy diet. Like there's not time. But you can only care for others if you're caring for yourself. You have to remain energetic and healthy. And so that starts with good nutrition. But it continues with the older adult and with people with chronic conditions. And so good care for nutrition. Oh my goodness. Good nutrition for care recipients is very crucial. And up to 50% of all older adults are at risk for malnutrition. And malnutrition can lead to complications with surgeries and complicated outcomes. Malnutrition also creates a higher risk of falls, and it can lead toward an increased rate of hospital readmissions. So basically, older adults and people with chronic conditions who are well nourished tend to have better muscle tone and fewer hospital readmissions and lower costs in general, which all of that makes a caregiver's job easier as well. So quality of life for, the person with the condition, quality of life for a caregiver, it is all good. So I keep talking about malnutrition. And I just wanted to talk about, what I mean when I say that, because I know that a lot of us think about malnutrition like we think about, the starving children in some other country, that kind of thing. But in actuality, malnutrition is a clinical condition that impacts a lot of people. And a lot of people who have chronic conditions like cancer or like diabetes, heart issues, so many conditions can be linked back to malnutrition. So there's undernutrition, insufficient food intake, but there's also insufficient nutrient intake. So that's important. For example, if you're not getting enough protein, chances are you're going to be losing muscle mass. Obviously, if you don't get enough calories, you're going to lose mass as well, but it's also about what you're eating. So malnutrition, insufficient food intake, it can also be diagnosed with weight loss over time, loss of muscle mass, loss of fat mass. Other signs include fluid accumulation and measurable diminished grip strength. So there are nutrition-focused physical exams that folks like dietitians perform, and that's how they detect those things. And I think it's also important to note that people who are malnourished could be underweight, and that's usually how it presents clinically, but you can also be completely normal weight, overweight, obese, and still have malnutrition issues. So it's something that, is of great concern, regardless of weight, and something we really need to be on the lookout for in ourselves and in others, regardless of weight. There's the condition of sarcopenia, which is someone who has lost muscle mass. You can be obese and have sarcopenia. and it's, that is like osteoporosis only with muscles, basically. And it's something that you really need to, again, be on the lookout for. So I have this pretty infographic um, with some statistics backing up what I was talking about. That up to 1 in 2 older adults are at risk. Hospital stays are longer. Malnutrition in general, rates of diagnosis are higher in older adults. And, we really suggest that all patients be screened for malnutrition, and that of those screenings, those found to be at risk receive a further nutritional assessment, diagnosis, and then an intervention plan, some kind of nutrition care plan to, help figure this out, because malnutrition is reversible. Poor nutrition is reversible. And that's something that I think, gets lost in some of this. That is one of the things you can control. You can actually control nutrition. So not in an unhealthy way, but you can make an effort to eat more healthfully. And there are a lot of ways to eat healthfully. I'm not a registered dietitian. I always like to make that disclaimer. So I am not going to tell you how to eat healthfully. You should definitely contact a registered dietitian for that, because they can tailor things to your situation. So unfortunately, I do not have the answers about paleo versus, the high carb diets versus keto. I'm not, I can't give advice on that, but I just wanted to say, malnutrition and nutrition in general, that is something that, can be helped. The national blueprint that I was talking about discusses the issue of malnutrition, and it also talks about some of these steps you can take as individuals and as community organizations to help prevent malnutrition, and to help, treat and, combat malnutrition, as my coalition name is Defeat Malnutrition. So we suggest that you might see if older adults or other family members might be eligible for nutrition services through things like the Older Americans Act, which I will discuss, or through programs like SNAP, the Supplemental Nutrition Assistance Program, also more commonly known as food stamps. There's a lot of community-based nutrition services that folks might be eligible for. Another thing that, we'd really like to see as a coalition is some kind of standard for training folks who are caregivers at home regarding things like nutrition. That's something that, you should be trained in. That it's not. We talked to a lot of folks who are either care recipients or caregivers, and a lot of people don't feel empowered to, have proper nutrition. Like they don't know what the proper nutrition is, or, they don't know how to properly prepare food that, might be on a special diet for themselves or a loved one. And that, that's something that I think we as a healthcare system really need to work on, since nutrition is so critical. We also suggest that you consider conducting awareness campaigns about malnutrition, and we have a lot of resources for that on our website. And, we also would like to see folks distribute some of the educational materials that we have that other organizations have, and just, educate yourself and your loved ones about what optimal nutrition is, and help them access these services. So nutrition education is vital. And, many older adults, many people with chronic conditions, all of us, we're all talking to each other. We're all relying on Facebook. If you think about the current situation with COVID, everyone has turned into a doctor. Everyone is providing all their Facebook information. And, so we tend to trust our peers and loved ones. And, we need to make sure that we are, you know, able to share the best information possible, whether that's on COVID or whether it's on nutrition. It's very important. Um, and it's particularly important for people who are caring for older adults or younger people with chronic conditions. I mean, it is just absolutely critical to know what you should be doing. So just wanted to reemphasize that. And as I was talking about with some of the blueprint action steps, some folks might need community-based nutrition supports, and access to this kind of safety net is really vital. People, older adults, people with chronic conditions might be eligible for SNAP, the Older Americans Act nutrition programs, which are Meals on Wheels, and home delivered meals in that vein, and congregate meals at senior centers. And caveat, I know a lot of those are not in operation right now, but a lot of the senior centers are providing things like grab and go meals, and they're providing things like converting people to home delivered meals, even if they're not homebound per se. There's also the Commodity Supplemental Food Program, which, if you have not heard of it, it provides older adults with commodity boxes, so dry goods that are pretty great as far as it's some of the basics you need, and it's a lot of cases it's delivered to the home. So, that's something to look into if you're having trouble affording proper nutrition. The issue is that many older adults, people with chronic conditions, in general, people who are eligible for these programs are just not participating. 3 in 5 seniors who are eligible for SNAP, for example, are not participating in the program. So millions of people are missing out on benefits that they are entitled to. So it's really critical that we make sure that people know this kind of stuff is out there. SNAP has a lot of participation barriers, between technology issues or even stigma, honestly, is a huge issue for folks. Even though, especially in the case of an older adult or a person with disabilities, you don't actually have to be, exceedingly like super poor, edge of homelessness. The it's quite a there's quite an income range that are actually eligible for SNAP, and so it's something that everyone should definitely, who thinks they might need the help, might look into that. In the case of things like Meals on Wheels, that's usually an issue of lack of funding, which creates really long waiting lists. And some senior centers, even before the pandemic, have been closing because of lack of funding. So, a lot of these programs get their funding partially through federal funding, partially through state and local funding, partially from private pay. And it's a huge issue when there are funding cuts, or there's just not enough funding. The for example, the aging population is such that we are getting more and more older adults and more people eligible for programs like Meals on Wheels every day. So the waiting lists just keep growing and the funding isn't there with it. But also I would, I've mentioned COVID a couple of times, and I feel like I would be remiss if I did not discuss COVID and the deep impacts that it's had on nutrition and caregiving. It has caused some real hardships in the community. And, as I sit here at home, I am, aware of that on some level. I mean, I'm very fortunate that I have somewhere to sit at home and do this. But, for people who were already isolated, for example, even if you have, you know, access to, say, your kids or grandkids. Now you probably don't unless you live together. So that's, social isolation in and of itself is a huge, huge problem. People, employment is drying up, and that's a huge problem. So, in response on the nutrition front, Congress has provided a ton of extra money for programs in the Older Americans Act, mostly from Meals on Wheels. And it's added some local and state flexibility provisions as well, so that these meals can be getting to people. And it's also provided a bunch of increases for other nutrition programs, like close to $1 billion for food banks. There's money and more flexibility for SNAP. I know that California joined the online purchasing pilot, so you can use SNAP benefits online, which is pretty cool and something you couldn't do before. But now with the pandemic in particular, it's really important to, if you're vulnerable, to not be leaving your house. So that online ordering is vital. However, as we all know, there are still gaps. There's stories in the newspaper about people waiting in miles-long lines, literally miles of cars worth, to try to get food from a food bank. There are huge issues here. So, it's something that we should all really be aware of, that this is, a serious problem for a lot of people. So this is a caregiving issue. This is a health issue because a well-nourished older adult person with chronic conditions, it's healthier. This is someone who is less likely to need nursing home care, intensive care at a hospital, around the clock at home. You're going to be able to maintain more independence, need less assistance. And frankly, at this point, something I did not put on this slide, but if you are less likely to need to be in a nursing home or in a hospital, that's pretty good these days as far as infection control. So, we're trying to keep people safe at home, and this is one way to do it. Um, this is a caregiving issue because there's a lot of caregivers who are depending on these public programs and on nutrition in general. And, we have a lot of older caregivers. We have a lot of caregivers who might be struggling financially because of their caregiving burdens. I mean, so these programs are significant for everyone in the family. Like, it's not just, it's a public health issue, as I said, as it is a personal issue, because this is all so intertwined, and it's huge for everybody. Um, so what you can do beyond, taking care of your own personal nutrition, if you're interested on more of a national front, you should contact your members of Congress and tell them how important these programs are. You can call the Capitol. I mean, there are still people there answering the phone, actually, which is pretty interesting. Or you can go to congress.gov and find your members' websites and send emails. I mean, these are, if these programs have impacted you, please definitely speak out, because, as a Washington advocate, I can say that I'm not necessarily always the best ambassador, because I'm, not someone using Meals on Wheels. So I can talk all day about how important some of these programs are, but, I'm not, it's the real world stories that really help. So, in short, nutrition is a public health issue because it's significant to, people with chronic conditions, older adults, their caregivers. But it's also a public health issue because it is costly. Not only is it, costly to individuals, if you're not well nourished, if you're not, doing well health wise, but malnutrition is pretty expensive to the system as well, to our healthcare system, and it drives up costs for everybody else. So, caregiving might compromise health or proper nutritional intake of family caregivers. And, if you're a caregiver and your quality of life is harmed, your care recipient is also going to have a poorer quality of life. I mean, it's that whole oxygen mask thing. But, as a caregiver, as a care recipient, you can make a difference both personally with your own diets and in advocating for these important public nutrition programs. So I'm going to stop there. I want to tell you about some of these resources. Our website, defeatmalnutrition.today, has a COVID-19 page. And on that page, we talk about some strategies to be less socially isolated, and if you're having issues and need nutrition assistance, that kind of thing. And we have a ton of other resources on the website as well, ranging from policy resources to practical resources. And we are actually working on later in the year, we should have more materials on things like ERAS, Enhanced Recovery After Surgery. So we're working on some consumer-facing material this year as well. Highly recommend that if you think you might be eligible for some of the public benefits, you or a family member or a care recipient, go to benefitscheckup.org. It's run by the National Council on Aging, and it is fantastic. And it has a vast range of benefits that someone over 60, over 65 might qualify for. So highly recommend that. NANASP is the National Association of Nutrition and Aging Services Programs, and I do policy work for NANASP, and we have some pretty good resources on our site as well. Meals on Wheels America, if you or a loved one is interested in receiving Meals on Wheels, they have a great local locator. The Elder Care Locator also, if you are a younger person with disabilities, elder care is kind of a misnomer in this sense, but they can point you to community resources, either on that website, or they have a phone number on that site you can call if you want to talk to someone to walk you through it. And here is my email address. Please contact me if you need help with any of this, if there's anything I can do, if you want to talk further, happy to talk to you. So with that, I can take any questions.
Thank you.
Again,
that's a
lot
lot
of
of great information.
but happy to take
I'm
questions
so glad I
that
have
are
this.
not,
I do have a couple questions for you. So in the meantime, feel free to add any questions you wish to ask Meredith in the chat box. Again, we do have our question board. Oh, we have a question on the board. So here we go. Do you see that malnutrition and dehydration come hand in hand in seniors?
Yes, absolutely. Malnutrition and dehydration, obviously you get a lot of hydration from food in general, but yes, typically people who are malnourished tend to be dehydrated, and dehydration, is something that happens, it's very comorbid. And chances are, if you're not drinking well, you're probably not eating well either. So,
I did have a
in both a
question here.
practical
Where
and
can one
a
apply
healthcare
for
sense,
SNAP?
yes, they
So,
do tend to go together.
with that question, I went ahead and just grabbed the website information for those two that are interested to feel free to apply. But is a SNAP a resource that they can find on the website, Meredith?
Yeah, on that benefits checkup site, they can tell you if you'd be eligible for SNAP, and they can also connect you with. I think most all of you are in California, so they can connect you with some of the local state work
Great.
as well,
And
because
then
it's
along with these
it is run
resources, which
state
by
by
the way,
state,
again,
so they
very,
can connect
very
you with your
good
state
resources
agency.
to have handy. Does the website help see which programs seniors are allowed to have, or do you only have a selected number of programs that they might qualify for?
On the benefits site, that one, they have quite a range. I don't run the site, but I know that they have things that you might not even think of, like home energy assistance, or some of, like, Part D, Medicare Part D actually has, low income subsidy assistance. So you can get help paying your premium. You can get help paying your copays. There's a lot of different resources there, and there's not. I would also say there's not really a limit on, okay, well, you have SNAP, so you can't have this resource. It all tends to work together pretty well. I mean, obviously, sometimes income limits bump up against each other. Some benefits count as income, but that is all complexity I do not feel like I can address. I'm not a benefits counselor, but yeah.
Right.
So
And then
I,
again, for
I
those of
encourage you to
you that are
apply if you
interested
think you
in
might be
learning a little
eligible,
bit
and,
more on
see how it works out.
some of the resources that Meredith shared with us, as well as information, that is going to be right below the presentation. You'll see it under offers. It's under Connect with Meredith. That is the link to that information. If you are interested in having the PowerPoint, I will be giving my email at the end of the presentation so that you have it and I can connect with you and give you this great asset. I do have a couple more questions for you, Meredith. So I know you said you're not a dietitian. For you. Would you recommend taking vitamins along with a healthy
Sure.
diet?
I'm not a dietitian, but I mean, I don't think you can go wrong with, a standard multivitamin. I don't, from what I know, as a layperson who does a lot of reading on this, I don't necessarily think you should go crazy with the vitamins. Like, you're not, you know, at a certain point, it's not helpful, but in consultation with your doctor, because they need to know if you're taking supplements. Again, I don't think you can go wrong with at least a standard multivitamin.
Yes,
I
I'm with
do
you on
take
that.
multivitamins, so
Another
I
question
can,
is there a
I hope
malnutrition
they're
or health
effective. Let's
chart
just put it
that
that
you
way.
would recommend available online? It's just pretty much, how there were at the beginning.
What do you mean by health chart? Like, oh, like an infographic kind of deal. Yeah, my website has some of our own, and there's that one on the slides, and in our resources site. So if you go to defeatmalnutrition.today
Mhm.
and click resources on that top menu, it'll take you to a page with a bunch of pull downs, and there's a link for
Great.
infographics. So you can click on that, and we have some, and we link to some that other people have put together as
Awesome.
well.
And then again,
The
I
Alliance for Aging
just added
Research
it
in
into the
particular
chat
has a
box.
really
So if
good
that's
one.
something that you're
So
also
that's on
interested in,
there.
feel free to copy and paste that since it was one of our questions. Um, let's see. Another question that I have here is, how are you involved with the community during this time? And so I know you are affiliated with a lot of smaller organizations. Is there anything in particular that you guys are working on?
So we've been heavily involved in the advocacy for like the extra funding for some of the senior nutrition programs. We've worked pretty closely with our friends at Meals on Wheels America to
Yay.
be involved in that. We've actually also launched a podcast through that NANASP organization called Essential Service, talking about the service stories of some of the workers on the front lines. Like, we are, I can't say that I am personally out there, serving people at a food bank every day, but I am trying really hard to support
Great.
the people who are.
Yeah, let me have that
So
information for that
that
podcast. I'd
is,
love to
our
share
goal
that
is to
with
get those stories out there and get them more
and anyone
funding.
else. Yeah, that'd be great. Yeah, yes, perfect. And
Yeah.
that'll
I can
give
send that
everyone
to
else the
you.
opportunity to
Actually, here, let me
check
put
that
the link
out.
in the chat box. Yeah, we're posting another episode in about a week. Our first episode just came out, and we're really excited. We got the administrator for the Administration for Community Living, which is the federal agency that works with seniors and people with disabilities. So we got him on and interviewed him about the work that ACL is doing, and they are doing a ton of stuff. So if you haven't heard of ACL, you should go to acl.gov. I know I am just like a fount of links tonight, but they have a great COVID
I'm gonna go ahead
website
and
that
add
has
that
a
in there
ton of
too.
like
So if
useful
I
information
that's
for
it, copy
people with
paste.
disabilities and for
I do have a message
seniors.
on here for you. It says we belong to the senior group and receive lunches weekly.
Yeah.
We are encouraging other seniors to sign up. We meet monthly with our park and recreation staff. When we are able to come together again, we will pass your message to them, Meredith. Thank you for providing additional information.
Oh, you are so welcome. No, I feel really awful for all the groups who can't meet right now. I mean, it's a huge, I know it's a huge lifeline for a lot of people, and this is it really sucks, just to be completely blunt. Like, this whole situation sucks. So I'm so sorry you're not able to meet up right now.
I might have one more
But thank you for the
question.
compliment.
Is Defeat Malnutrition Today affiliated with programs in California? So I know like the Meals on Wheels is something that we've been able to kind of have around within the California state, but are there any other programs that you think automatically, oh, this is something we have here and I know you guys have it in California, like take advantage of that?
Yeah, I mean, California has some great benefits programs,
Yes.
honestly, like beyond SNAP and that kind of thing. I believe is it CalFresh out there? But yeah, so beyond like the federal resources, there's a lot of the area agencies on aging. In California that, a lot of them are affiliated with like your counties, and they have excellent resources. I know there's a lot of them out there that have turned, much like this web meeting, turned a lot of their activities
Yes.
into web-based things. So like book clubs and yes, I see the chat. The Office on Aging's, yeah, they're doing a lot with the COVID stuff. So if you haven't been in contact with
And
them,
I know you
I
just chose
encourage
the
you to
chapter
check out
here,
your
so one
local
last
agency.
question. How common is malnutrition in seniors? The last question is, how common is
Sure.
malnutrition in seniors?
I'm sorry? Oh, yes. So people who are at risk for malnutrition in the community it's about half. But of people who live in the community who are actually malnourished, like the incidence rate is closer to probably 15 or 20%. So that's still pretty high. That's a lot of people, but it's not, overwhelmingly, a lot of people with malnutrition who are seniors are the people who have chronic conditions already. So, it's really important, if you're someone who has some kind of condition, definitely take there are malnutrition assessments online, little like mini quizzes that you can take. That sounds very that sounds very youthful. You can take an online quiz and diagnose yourself. But, seriously though, there are some assessments that you can
Yeah.
do by
And then we do
yourself
have one
to
more
see if you are
question
at risk
on
and
the
if you should
wall.
talk to your doctor more
Do
about
seniors
it.
need a different amount of protein and vegetables versus younger people?
So seniors do actually need more protein. That is, yeah, that is something I can say with confidence, despite not being a dietitian. Seniors do need more protein. That's what the research is showing. It's I it varies so widely by person, like, as in, so I can't tell you, you should have 80 grams of protein a day. So it varies like by gender, it varies by even by age, but yes, in general, you should be eating more protein than even the
Awesome. That's
recommended
good to know. I
amounts.
didn't know
I mean,
that.
don't go crazy on that, but definitely make sure you're
And
getting your
I think those
protein.
are all the questions. Any last minute questions? I'll give you a couple, maybe 10 seconds to go ahead and type those in so I can go ahead and ask Meredith while we're all here together. Those were great questions. Yeah.
Yeah, those
Again,
were really
so
good
just a
questions.
quick
Thank you.
reminder, if you go into our offers tab, you will find all the links to connect with us. The Riverside Medical Clinic Charitable Foundation. You can find us through our own website, Facebook, Instagram, and YouTube. We do have also upcoming webinars, so if you're interested in signing up for that, feel free to register. That link is right there. Click that blue button. It says register. And join us for some other great webinars. And then Meredith, connect with her if you're interested in learning more about Defeat Malnutrition Today. Again, that link is also there for everyone. And then please, if you have the time, give us some feedback on the webinar that you've attended today. It's really, really easy, straightforward, not a whole lot to do, and submit that in for us to review. Again, I am going to enter my email in case that anyone here wants to either connect with Meredith and needs this information through an email, or maybe you want the resources she provided. I would be more than happy to give that to anyone that actually emails me. Let me type that in for you guys. There you are. Copy and paste that onto a brand new email form. And I think that's pretty much it. Meredith, I want to thank you so much for taking the time and coming on here and sharing such great information with all of us. I will be uploading this onto our YouTube for all of the members that couldn't make it today. So I will be sending you a copy of that, Meredith. And everyone that's here, if you want a replay of this, please let me know. I will send that out.
Okay.
We have quite a few coming up with a lot of stuff for everyone. So again, Meredith, thank you so much for taking the time and doing this and joining us and sharing this great stuff with us. Is there any last minute announcements you want to make? Yeah, thank you. Thank you so much. Well, thank you so
I
much
don't
for
have
joining
anything.
us.
Just thank you so
To all
much
of our
for having
members,
me.
I
I
hope you
really
guys have a
enjoyed this.
great evening, and I hope this inspires you to go have a wonderful dinner. Yes, and yes, you can have a lot of protein.
Yes, have a great dinner.
Well, thank you so much, and you guys have a great night, and have a great night, Meredith.
Protein.
Bye, everyone.
Thank you. Bye.